Hello, I'm Julie Lafford. I'm the Executive Director of Alumni Engagement at York University, and I'm currently in my home office, as I'm sure many of you are, whether it's in Toronto, other parts of the country, or other parts of the world. Today, I'll be moderating a panel discussion with some of the university's leading researchers on the COVID-19 pandemic. Whether it's from home, from their labs, from hospitals or assessment centers, York researchers and alumni are actively participating in the fight against the pandemic currently sweeping the globe. And even though we can't come together physically, we aim to continue to offer you programming and events virtually so that we can stay connected and informed during this challenging time. Although we can't be on York campus for this event, I'd still like to acknowledge that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of the university. York acknowledges its presence on the traditional territories of many Indigenous nations. And now I'm pleased to introduce our three panelists who are also faculty members at York, and all of whom are leading experts in their field. Our first panelist is Dr. Eric Kennedy, Assistant Professor in the School of Administrative Studies at the Faculty of Liberal Arts and Professional Studies. Eric's an expert in disaster and emergency management. He's also the founder and director of the Forum on Science, Policy, and Society. Thank you for joining us today, Eric.
Thanks so much for having us.
Our next panelist is Dr. Cary Wu, Assistant Professor in Sociology, also in the Faculty of Liberal Arts and Professional Studies. He's an expert in political culture and migration. Cary has expertise in social and political trust, as well as data and applied statistics. He's also a member of the York Center for Asian Research. Welcome, Cary.
Thank you. Thank you for having me.
Our final panelist is Dr. Jianhong Wu, Distinguished Research Professor in the Department of Mathematics and Statistics in the Faculty of Science. He's an expert in infectious disease modeling and big data analytics with expertise in pandemic influenza, avian influenza, and emerging and re-emerging infectious diseases. Thank you, Jianhong, for joining us.
Thank you for having me, Julie.
Today we have a series of questions for you related to the pandemic, of course, but please feel free to jump in with thoughts or comments at any time during the discussion. So my first question actually is for Jianhong. Were just recently, it was announced that you will be a member of a national COVID-19 rapid response task force. Can you tell us what you'll be working on?
Yes, it's a national task force put together by 4 national mathematical research centers from Ontario, from Quebec, from the Pacific, from the Atlantic region. And the purpose of this task force is really bring together national expertise in infectious disease modeling. And our purpose is to project the risks in the population and to evaluate the intervention strategies and intervention programs, and eventually to assess conditions when the intervention should be strengthened or intervention can be relaxed so that we can go back to normal.
Thank you for that. Now over to Eric and Cary. You both recently received funding from the Canadian Institutes of Health Research for your COVID-related research. Can you each tell us a bit about the projects you're working on with that funding?
Sure, happy to. So in our project, we're looking at the social and human side of the outbreak. We're trying to understand how Canadians are experiencing, how they're reacting to, how they're preparing for this coronavirus pandemic. And so to do that, we're using a few different methods. We're running national surveys across the country to try and understand and hear the voices of different Canadians. We'll be doing a series of a few hundred interviews with different Canadians over the next couple of years. And we're also launching a national tracker that will keep track of all of the survey and polling research that's done by ourselves, but by other folks around the globe to try and help evidence-based decision-making in this field. And so bringing these together, we're basically trying to understand how Canadians are experiencing the epidemic and understand the social side of some of these measures that we're taking, and perhaps what might be sustainable over the long term or what might not be.
And would that be things like the social distancing that we're all currently doing?
Absolutely. So we're exploring a few different themes in our study. We're looking at themes around knowledge. So what do Canadians know about the outbreak? What do they wish they knew? And who are they turning to for information? This could help to inform discussions about how we can combat misinformation online. We're looking at things like how this affects people's ability to work, how their relationships with their employers are evolving, and how this is affecting people in terms of layoffs and unemployment. We're looking at some themes around policymaking and government actions too. So what actions do Canadians want to see taken more strongly? What actions are they perhaps more opposed to? And does it matter who those decisions are coming from? For instance, if it comes from your premier versus your chief medical officer, does that make a difference? So all of those themes will help us to understand basically how they're experiencing the pandemic, but also which of these interventions are more palatable.
Thanks for that. And Cary, what about you?
I'm a political sociologist, so I've been studying trust for many years. So for this research project, I study the dynamic of three types of trust: trust in government, trust in people, and also trust in interracial, trust kind of like ethnic racial groups during, before, during, and after the outbreak. Right. So specifically, I'm looking at two questions. First is looking at how trust shape people's responses to the outbreak. For example, looking at how individuals, more trusting individuals, whether they are more likely to comply with policy measures, or like more trusting places, whether those places are better prepared for the outbreak. So that's the first question. Second question is looking at how kind of the outbreak, the crisis, is affecting people's trust, right? So thinking about people doing social distancing, whether the social distancing might kind of like affect people's trust afterwards in kind of post-crisis period of time. And also looking at how government have performed during the outbreak, right? Better performance might kind of enhance people's trust in them, or if they did not do kind of a good job in kind of responding those the outbreak, they might kind of like undermine people's trust.
Great, very interesting, thank you.
Yeah.
Next question is back to you, Eric. From an emergency management perspective, what's most struck you about how COVID-19 has been handled, not just in Canada, but around the world? And is there anything that you think that has been particularly successful, or anything that we should be doing better?
Great question. So as someone who works in the field of emergency management, we're used to dealing with disasters that overwhelm our capacity, but this coronavirus outbreak is really unique in a few different ways. One of them is the scale, right? This touches every part of our lives all around the world. Another is the lag that we've seen. So the decisions that we make today will be reflected in some of the outcomes a week from now, 2 weeks from now, a month from now. And so there's a temporal lag that happens between when we make our decisions and when we see the outcome of some of those decisions. So that makes it challenging to manage and challenging to evaluate this kind of event. I think things that we've seen working well so far, some of our very early data is showing that Canadians have really taken to trusting the experts, right? They're looking to their chief medical officers for advice. They're following these evidence-based practices and following the science to do things like physically distance, to wash their hands. And so that trust in experts has worked really well. Another thing that we could point to is the fact that in Canada, at least, I have to say that a huge number of people, both at the political level and day-to-day Canadians, we're doing a good job of not making this a political partisan sort of thing. At the moment, it really does seem like there's a lot of rallying around Team Canada and coming together to work towards this common goal. And some of the early returns we have from our survey really suggest that it's not sort of hyper-political yet in Canada. And so that's been a success so far, and I hope we can maintain that. We've also, in Ontario, because of our history with SARS in the past, I do have to give a nod to some of the bureaucratic and public servant apparatus here. There's a lot of learning that happened after the SARS crisis that helped us to change our public health system and be better prepared here. And so bureaucracy often gets a bad name, but I think it actually has served us pretty well thus far. Finally, I would say, just as a quick note, there's been a lot of collaboration between researchers on this topic. We've really seen a fast mobilization of the research community and an openness to data sharing and collaboration. So Cary and I, for instance, are working together on our research projects to try and collect more data together than we could on our own. And so that kind of collaboration within Canada and beyond has been really effective. I think the biggest challenge, though, comes down the road. As you know, this is probably something that's going to carry on for quite some time, not just days or weeks, but for months or maybe a year or more. And so the real question will be, can we maintain these successes over the long term? And how do we find a sort of sustainable path forward that keeps the disease in check while allowing us to be sustainable physically and in terms of mental health and in terms of economic performance? That's going to be a big challenge, and why the research that Jianhong and Cary are doing is so important.
Thanks for that, Eric. Yes,
so,
please.
Thank you, Eric, for mentioning, linking this to all the research groups. I think you touch on the base on really how the intensive intervention measures can be sustained. I think this is a very important issue. I think we are in a unique time in the history that the individual behavior can contribute to the risk reduction, both in terms of the individual itself and in terms of the community. So I think this is one of the time each individual can contribute to the prevention control of diseases.
Actually, Jianhong, my next question is for you. And I know you've worked with colleagues in China, and then you've also conducted some comparative studies amongst Korea, Italy, and China. And what lessons can we learn from what you've researched?
Yes, I think Canada is lucky to have witnessed the epidemic in progress in other part of the world, and especially in China and Korea and Italy. And some of the intervention measures implemented in China and have been very stringent, and however, it's very successful. So you have a short-term sacrifice of the entire society, and however you successfully contain the disease within still relatively short period of time. So the country is going gradually back to the normal. And South Korea is taking a slightly different route, and it has achieved very successfully by rapid testing and intensive contact tracing and then quarantine. And this is a route that I think Canada can learn. And Canada has been trying to avoid to be the second Italy. However, we have to know that we have very much economic situation, and we have very much similar demographic profile with Italy. And so we really have to locate the situation in Italy to see how we can do better compared with Italy. I think we're doing better in compared with Italy.
Thank you for that. And I know, Cary, you're also doing comparative approach, taking a comparative approach, I should say. And why do you think it's important to have that comparative perspective in studying global responses?
Very good question, right? So that globally, we are kind of facing the same virus. We are fighting against exactly the same outbreak, right? The virus. So that's why, it's kind of from a research point of view, it's very, very kind of a great opportunity to do comparative work, right? We can compare varying responses across countries, society, and thinking about why the different government, different society and community have been responding to the outbreak in very different ways. So that the two things we can get in from those comparative work. First is like to see whether some responses are better than others, or whether some kind of policies are more effective than others, right? By comparing different across societies and countries. This is first thing. Second thing is that thinking about that, right? Why do people respond, or why the government respond in different ways to the same outbreak? That really is that the virus reveal kind of social norms and the political institutions across places, right? So we can understand responses in a way that to understand different culture, understand different society a little better, using the same kind of like a virus outbreak, using the outbreak, right? So that's why doing comparative work is very important for now.
Thank you for that. So I have just one question left, and I wanted to ask all three of you something that's going to be really relevant to everybody who's watching the video. What do you know about the effectiveness of social distancing? I also hear a lot of people calling it physical distancing. So I'll start with you, Jianhong.
I don't think it's really social distancing. My social activities through internet has been intensified a lot. So it's indeed it's a more physical distancing. And I'm glad you asked this question about me, because we are trying to put the numbers, try to evaluate the effectiveness of interventions implemented both in Canada, also in comparison with other parts of the world. We have some good news. So here are some of the recent study from multiple research groups within my lab. We're putting different groups together, but we try to put in different things so they can really provide cross-validation of each other. And it turns out that our social distance measures have a result about reduction of effective transmission contact by 1/3. That has reduced the growth rate by half. It's equivalent to double the doubling time, and this is very significant. It's a huge contribution towards the flatten the curve in Canada, and we can do more, we can do better, and I think we have achieved the result, the strongest intervention measures implementing during the latest period of time, and we have seen some good sign from Italy, for example. The epidemic has reached its peak value, and we have seen some of the values from BC that we are cautiously optimistic that the peak time has been reached. So we might be able to see the decrease of the confirmed cases. And the key is what Eric mentioned, is really the persistence of the maintain the social distance for some time, so that we can go and gradually return to normal.
That is good news. Good news. Thank you very much. Eric, what can you add to that?
Sure. So 3 really quick points. One, of course, is this theme we've been hitting on so far, which is the sustainability of physical distancing. How long can we keep this up? We're in a really critical phase right now. And so it's crucially important that people are following the instructions and getting this curve flattened immediately. But as we bring it down and as we eventually see success with this, there will be lots of questions about sustainability. How do we make this something that we can do over the long term? One of the things I've been thinking a lot about lately is how we're going to have to be unreasonably reasonable until we at least get a vaccine, right? As we transition to the phase that some are calling the dance to keep the spread low, that we're talking about sustainable distancing, there's going to be more need for discretion from people, for people to make reasonable choices. And we're going to have to hold each of ourselves to a very high standard, right? As measures perhaps relax a little bit, when they do, and that's not yet, but when they do, we're going to have to be incredibly judicious and very reasonable personally in how we interpret these things, and still play our part even as we move towards this new normal. And then the third thing I'm thinking about is some of the issues of equity and justice in this, right? Some people can distance themselves more than others. We sitting at home on our webcams are very fortunate that we can continue to do our job remotely, but there are a huge number of Canadians who are working really hard for all of us right now, whether that's in transportation chains, whether that's in frontline response, whether that's in keeping transit moving so that people can get around. There are millions of Canadians who have these really essential roles that we might not have acknowledged until this crisis as being so essential. And so granting that recognition is critical, but also acknowledging the way that some people have the luxury of being able to distance and others don't. We're going to have to think about how to deal with some of the fairness and equity pieces of that, because your socioeconomic status, the kind of job you have, that really affects the risk that you're forced to take on. And so we need to think about that too.
Thanks for that. And Cary, over to you.
I just want to add one thing, is that Canada is a high trust country, right? So that's probably explain why Canadians are doing better job in terms of social distancing, right? Also that lower in terms of community spread, right? Canadians, we really care about each other a little bit more, right? When people trust each other, they care about each other. So, right, so that's social capital trust is really, really important, thinking about how we should think about others, right? Not just, okay, think about themselves. And we are not afraid of virus, of course, but then we have to do social distancing, not to spread to others. So that's one thing that we are Canadians, that we do a better job than maybe Americans, right? Relatively. From the survey data that keep showing that Canada, we have more trust than other places. So that's a good thing. Keep it up.
Sorry about that. Zoom fail. That was it for my questions today. But I did want to open the floor for any final comments that you have, thoughts for our York alumni and community members that might be watching today.
Maybe I can add. Maybe I can.
Yes, please.
add a comment, because we know of alumni distributed across the country and across globally, and one of the things we observed is the timing of epidemic peak in different parts of the country and different parts of the world are different, and therefore a global coordination of the interventions is very important. I'm very glad the government is implementing some guidelines in terms of the mobility, and I think we might excise and we might witness some of the intervention measures implemented in different parts, gradually removing this in a different time sequence, and I think this is the time, as I said, it's each individual's behavior, each community's behavior, each province's behavior is going to contribute overall to the health of the entire communities. So we shall alumni good health, and we all recover very soon.
Yeah, I also hope everyone who is watching this doing well at home, and then think about others, to work together, to kind of do it collectively to fight against the outbreak. I think very soon we will be able to contain the outbreak.
Thank you.
Yeah, I'll echo all of that and wish those watching well. Thank you, Julie, for hosting this. And I hope this can be part of a longer term conversation here. We're eager to share our results from the survey, for instance. And so you can find our lab group on Twitter, and perhaps we can share a link with this video as well. But we're delighted to, as we get the results in and as we release some findings, to share that. And I'm excited to see the results from these other projects too, because they're so important, and some of the other exciting research being done at York around coronavirus is so critical too.
Absolutely. Thank you, all three of you, for being here. I also look forward to seeing the results of your research, and I hope that we can meet again, possibly even in person at some point, and discuss what you've discovered. This is a developing situation and going to remain of interest to the Canadian public for a long time to come. I do want to thank you again for taking the time to be with us. I can't imagine a more hectic time in your careers than what you're experiencing right now, between being at home, your teaching, and your research responsibilities. you know, the social work that you're doing, or social service work that you're doing as well. So thank you all very, very much for taking this time out with us.
Thank you.
I also want to, thank you. I also want to thank our viewers today. I acknowledge that more than ever, there's media competing for your attention. So I really appreciate you taking this time with York University. And on behalf of York, I do wish you all continued health and wellness during this unprecedented time. Be well.
Thank you. Take care.